Hi class, I hope this message finds you well. As we are in this week, we're going to be tackling the topic of trauma, right? And you're focusing this unit on stress and the related factors, the related risk factors and diagnoses, the impact of trauma on physical, emotional, developmental, and behavioral health. Really here, you're going to start hearing the buzzwords, right? ACEs, right? So adverse childhood experiences and the impact ACEs have not only on mental health, but overall wellness and health futures. There's a lot of current attention looking at the number of ACEs that one may be exposed to. And of course, with the increase in the number of ACEs is the increase in risk to well-being, to physical, emotional, mental health, spiritual health, behavioral health. And so I did put a few links in our announcements with this video to take a look at the ACEs. So a lot of work is focusing in our field on trauma-informed care, so how to approach therapy with a client, how to approach someone who's experienced trauma, multiple trauma, chronic stressors, right? So looking at how our work has shifted over time. For a very long time, trauma was really only tied to military. Thankfully, we shifted course. The umbrella of what trauma is or can be has widened a bit. And so we're looking at not just sustaining exposure to one trauma, something as traumatic as, a violent act or being a victim of a crime, but also exposure to multiple traumas. And so maybe living in an impoverished neighborhood with exposure to violence and exposure to some other stressors that occur in such environment. So really how that impacts one's functioning over time. So as clinicians, we're really shifting our course to consider that lens differently as we treat the patient, the disorder, and kind of giving them kind of different coping skills, resiliency, and hope to move forward. You're also in this unit looking at factors that contribute to substance use in teenagers. And so what are some of those risk factors you have to look for? How is that managed or dealt with differently? We have a discussion board this week. As always, your first post is due by Thursday evening, and your peer responses are no later than Sunday, but we do want you to engage with your peers no later than Saturday afternoon, saving that Saturday late afternoon, evening, Sunday evening for kind of some final wrap up, because it's hard to have a discussion if you're just posting for the first time at like 11 o'clock on Sunday. So if you have any questions, please feel free to reach out. I look forward to reading your posts, commenting, and engaging with you. And there'll be some stuff related to ACEs resources for future clinicians in our post this week, the announcement. So I hope you have a great week. Thanks.